This module outlines medications to review when called to see a patient with urinary retention. By the end of the module, you should know what medications can cause urinary retention and know what deprescribing is. Urinary retention, or inability to completely empty the bladder of urine, is common in the hospital setting. Medications are an under-recognized contributor to urinary retention. In particular, medications with anticholinergic properties can contribute to urinary retention. Medications used for the treatment of overactive bladder or incontinence, such as oxybutynin, solifenacin, and mirabegron, can also cause urinary retention. Analgesics can also contribute. Opioids act on mu and delta opioid receptors in the bladder and inhibit the parasympathetic nerves that usually signal bladder fullness and contract the bladder. NSAIDs can inhibit COX-2 expression and the synthesis of prostaglandins, which are involved in the contraction of the bladder muscle. Various medications have anticholinergic properties, including antihistamines, antipsychotics, antidepressants, Parkinson's medications, and these medications can contribute to urinary retention. Benzodiazepines can also cause urinary retention by acting on GABA receptors, leading to skeletal muscle relaxation, which interferes with bladder detrusor muscle and urethral sphincter action. Calcium channel blockers can cause urinary retention by blocking L-type calcium channels in the detrusor muscle of the bladder, which is the main muscle responsible for contracting to expel urine. So if you review the patient's medications and decide that a medication is not required or potentially causing harm, the next step is deprescribing. Deprescribing is the planned and supervised process of dose reduction or stopping a medication that might be causing harm or is no longer of benefit. Deprescribing aims to reduce polypharmacy and reduces the potential harms associated with inappropriate medication use. When deprescribing medications, some medications such as centrally acting medications should not be stopped suddenly, as this can result in withdrawal symptoms. For centrally acting medications, reducing the dose by around 25% every 2 to 4 weeks is generally acceptable for most medications. The rate of reduction will also depend on the dose taken by the patient, the duration, and what side effects they are experiencing. There are various deprescribing guides available, which can provide guidance on how to safely deprescribe a medication, and these are listed below.